Hey, welcome to the stream. I'm Josh Rushing, sitting in for Femi today from my home here in Fairfax, Virginia. Thank you for joining me. Now, right off the bat, if you're watching on YouTube, you see that chat over there? The box? Those are live. Get your questions in there. Producer will try to get them to me, and we'll try to get them in the show as we're going. I want you to be a part of this with me. Now, today we're talking about should kids return to school in the U.S.? Now, I'm coming to you from Fairfax, Virginia. This is one of the 10 largest school districts in the country, around 190,000 students here. And I had to make a decision as a parent this week. Do I want my children for the entire school year either to return to school in person or to do it online? And once you made that choice, you were pretty much committed to it. I have 4 kids in the school system here. That meant someone going into kindergarten, someone going into high school, someone going to middle school, and one going into 5th grade. And we had to make the choice for all of them. Remind me at the end of the show, someone, and I'll tell you what choice we made. But it was not an easy choice to make as a parent because the virus in the U.S., unlike most parts of the world, is actually surging. We're over 3 million cases, over 138,000 dead. And the president of the United States has come out in the last week and said he wants schools to fully reopen. And what he means by fully reopen, he means students present in the classroom. I'll show you a tweet here real quick. This is a tweet from showing the White House statement on this. Their statement was, the science should not get in the way of this. They want kids back in the classroom. Now that is, as all decisions out of the White House, out of any White House are, that is a political decision and a political choice. But as a parent, we want the science so we know what's happening with the kids. Now, join with me. Today, I have an exciting panel. I have 2 educators from across the country, and I have an education reporter from National Public Radio. I'm going to ask them to introduce themselves. I'm going to begin with Anya. Anya, can you tell us who you are today?
Good morning. My name is Anya Kamenetz. I'm an education correspondent for National Public Radio, and I cover reopening schools across the country.
Thank you. Julia.
Hi, I'm Julia Torres, and I'm a librarian and language arts educator in Denver Public Schools in Denver.
Great. And Manuel?
Yeah, my name is Manuel Rustin. I'm a high school history teacher out here in the Los Angeles area, and I also co-host a show about education called All of the Above.
All of the above. Very cool. It's a podcast, right, Manuel? Where can people find that?
Yes.
It's a podcast? Where can they find it?
Well, and it's on and it's a YouTube channel, aotashow.com. We'll take them to whatever platform they want to see it on.
Nice. Okay, Anya, so we have a large international audience. Can you explain to them how the school system is set up a little differently here? I think if you're outside the U.S. and you see Trump, tweeting and going on about schools need to go back, fully reopen, they may not understand that Trump doesn't actually control schools in the U.S. What's it like, the situation?
That's a very good point. So we have almost 14,000 separate school districts here in the United States, and each one of them has some level of local governance. And that's why the decision is really devolving to a very large distributed network of authorities. When the president tries to use the bully pulpit to say schools should open, we should keep in mind he only controls less than 10% of the budget for public schools in America. And most of that money is already allocated to low-income schools. So, the only way that the federal government could have really important influence on reopening schools is something they have not done, and that's to pass significant funding to make up for budget shortfalls that have already happened because of COVID-19, plus all the extra costs to reopen, which has been estimated at upwards of $250 billion. None of that has been allocated so far.
So I want to bring in a soundbite from someone in our community. This is Dr. Nicole Turner-Lee, and she's referring to what happened here in the U.S. is kids stopped going to school in about March. Normally the school year ends around May or June. So they all stayed home because of the lockdown, and they went to online learning. And I don't know anyone in the U.S. that says that experiment went very well. Here's what Dr. Turner-Lee says about moving forward here.
We found 12 to 15 million school-age children out of 53 million that were without broadband access. And about 9 million of them did not even have home broadband nor a device, according to some recent research by Common Sense Media. So what does that mean going forward? As schools try to consider the best ways to mitigate the spread of the virus while ensuring that there's no disconnect when it comes to learning, they need to reevaluate what went wrong in the last few months when it came to distance learning. I'm advocating that schools need a 21st century remote access plan if they are going to safely reopen and ensure there are no disconnects going forward as we try to figure out how to slow down the spread of this deadly disease.
So, Manuel, what's it like at your school district? What was it like for the online learning that happened in the spring? And then what decision have they made moving forward?
Sure. So the online learning that happened in the spring, obviously everyone was caught off guard. So we were all scrambling to try to make the best out of the situation as possible. And what we found was, even though our students in our district, I teach in Pasadena Unified School District, every student has had a school issued Chromebook for quite a while. But what we found was that in households where there were multiple district students living in that household, internet connectivity was a real challenge. And we're here in Los Angeles. So if the Los Angeles metropolitan area has any kind of corner where Wi-Fi isn't very strong, or where multiple people in one household, where that becomes a challenge for Wi-Fi, then you can imagine what it's like in rural communities and in other cities out there. So that was really the biggest challenge, that even with the technology in their hands, students had a really hard time connecting. And then, of course, you had the challenge of students having to also watch their younger siblings, because I teach mostly high school students. And many of them became sudden babysitters, and many of them were essential workers too. So in some cases, even with the technology strong and intact, there was still the challenge of getting students to engage in the learning because of the reality of trying to survive in a pandemic.
So what's the plan for the fall?
So for the fall, we initially had a hybrid plan that was proposed, and then we heard back from a lot of teachers and parents saying that they want an online only option. And then as cases began to rise across California, the decision was made to go fully online. And in fact, our governor declared that any county that doesn't have a decrease in cases is going to have to start off the school year fully online. So we're starting off fully online August 17th.
And how about you, Julia? What's your school district doing in the fall?
So we were told that we needed to come back in person on August 10th, and that the first day for students was going to be late August. So I think it's going to be August 24th. My understanding, I also have children in the school district, and they're in a different school district, but still in Colorado. And what we see is that the school districts tend to band together and do the same thing when they're centered around the same metropolitan area, even though the circumstances that students are facing can be drastically different. For example, I live in the suburbs, and life in the suburbs is very different from life in Denver proper. So what it looks like right now for my own children at home is that we have the option to do completely online, or we can come back in person. And there's a date by which you have to notify the district which you would like to do for your students. Similarly to what we experienced in the spring, it's changing weekly, if not daily. So I know that they're sending out notifications saying that they want to keep up with the science and that they'd like to keep up with recommendations from state health officials and government health officials, and just let us know kind of what the research is saying before we have anything set in stone. So right now, it seems like the norm is to have an online only track and then an in-person track. And that's what I'm noticing in my own district as well.
Yeah, Julia, that's what they're doing here in Fairfax. You have the two, and you have to make the choice. You mentioned that, not everyone's living in the same kind of community. I want to bring in another soundbite from our community. This is from Amita Sudhir, who's at the University of Virginia. No, I'm sorry. I know I'm driving the guys in the control room crazy. Let's go to Ruth Faden. She's a PhD with an MPA, which is a master's in public health, and she's at Johns Hopkins.
Children who were already disadvantaged prior to the pandemic have suffered the most. And these kids, children living in poverty, children in remote rural areas, children of color, children with differential learning styles, homeless children, these children desperately need allocation of resources to them to make sure, or at least to try to keep, the gap that existed before, that was widened by the pandemic, from not widening further.
So, Anya, President Trump has tweeted about cutting the funding to schools if students don't return in full. You mentioned before that that's not a ton. We're talking about like 9% of funding comes from the federal government, but that funding tends to go to the poorer schools, right? So schools that already would be the most economically challenged during these times might be looking at less funds coming from the federal government. Won't that just go to widen the gap that Ruth was talking about in that bite there?
You know, I do think that that particular threat is probably going to turn out to be empty. But what we are seeing right now is that states, because of their balanced budget amendments, are being forced to cut education budgets. And that's happening all across the country. And so even as districts are heading into these unprecedented semesters where they have to both plan and execute remote teaching as well as hybrid teaching and do all this overhaul to their infrastructure, teachers are getting laid off at the same time, and schools are being asked to do basically twice as much with fewer resources because of the hurt in revenue at the state level. And I just have to mention once again that the House passed a bill with billions of dollars in additional funding for schools. That bill was passed in May, and the Senate has yet to act. So there's a very, very large gulf here between the kinds of statements that are coming from leaders in government about what they would like to see happen versus the money to pay for it.
I want to bring in some YouTube comments here. We got one from, it looks like, is this Ray Ray? This is what happens when you elect a game show host as president. We're now living on Survivor Island. From Blue Jay, Quebec, Canada, tried, and after 23 students and staff got the virus, they shut the stupid idea down. Nene Marina, a question for the panel. Has the U.S. government laid down a plan to prevent a coronavirus surge in schools? If they reopen, controlling children is pretty difficult. That's a good question for the panel. I'm going to set that up here with what the CDC is saying. So if we can go to my computer, I'm going to show you this kind of chart that the CDC has. It says, should you consider opening? And it says, will it be consistent with state and local orders? Is the school ready to protect the children and the employees? I want to talk about that a lot here in a second. Are you able to screen students and employees? If any of these are no, do not open. You move to the next set. Are there recommended health and safety actions in place? We're talking about the hand washing, the wearing the PPE, the intensified cleanings. Are you able to keep social distancing with the kids? If any of those are no's, you need to meet those safeguards first. If all those are yes, then you go on to, is there ongoing monitoring in place? Now, how are schools going to do that? It all comes down to money at the end of the day. And here's what is. What will it cost to reopen schools? When you look at how much we're talking in PPE and hand sanitizer and the cleaning and the additional staff, we're looking at about almost $1.8 million per school district. This is at a time when school districts are facing cuts. This is at a time where teachers spend their own money out of their pocket to bring in enough pencils for the classroom in some school districts. And now we're saying that you need $1.8 million per average school district. I know my school district, that number will be much, much higher because of the size. So, Manuel, do you feel like your school is doing enough to keep, well, you're going online. Let me switch this to Julia, because they're asking you guys to come back into the buildings. Do you feel like they're doing enough to keep you safe?
Well, I will say that I don't have all of the information that I'd like to have before I go back in person. I've mentioned to you that I'm a language arts teacher and a librarian. My primary responsibility is for the library. And I don't have any kind of para-educator assistants. I don't have any other librarians working with me. The student population in the building is around 2,000 students. So even if half of them came back, that would be 1,000 students in the building. My library is right in the middle. I am not really sure what circulation would look like. I've been encouraged to circulate the ebook circulation of titles, which has over 18,000 titles. So we have a gigantic ebook circulation process. And what's wonderful is that our students do feel comfortable checking books out, audiobooks and ebooks. But as far as classroom teachers go, I don't have a classroom. My classroom is the library. So typically at any point during the day, there are lots of people in there, either holding class, meeting with students one-on-one. I don't know that that's possible or even a good idea. I don't think it's a good idea, even if just half the student population opted to come back. I also am very concerned about the student population that is in homes where the primary languages are not English. And I'm not just talking about Spanish and English. We have many students who are from the Marshall Islands. We have many students who are from West African nations, and the predominant language spoken at home is French. We've got some who speak Amharic and Arabic at home. So communicating in English with me, rapid changes has been a challenge. I cannot imagine communicating rapid changes in other languages with families in a timely, efficient manner that's going to make conditions equitable for all. So my concerns right now are about just the logistics of how we are going to make school work. And then, so it's, as far as do I feel safe? No, absolutely not. But I also don't feel safe going to the grocery store, even though they tell folks that they need to wear masks, because there's so many people still milling around, and many people still choose not to wear masks and then just deal with the consequences if somebody tells them that they need to. And then as a Black woman, I'm aware that healthcare disparities would make it so that if I were to contract the virus, I'm not even guaranteed that I would achieve healthcare that would save my life. I know that there are some places where people are on the floor unable to get hospital beds. So all of these things are kind of milling around in my mind, and the general attitude toward teachers is that we need to make sure that we put students first. And I need people to think about what that really means. What does it really mean to put students first? Because I think the assumption is that that means that I'll lay down my life for them. But I have serious concerns if I were to be asymptomatic at school as a librarian, pass it to somebody. Adults come to the school all the time. Give it to somebody who's then going to take it home. I mean, just because children, as far as some people say, are not the primary contractors or disseminators of the virus, which we don't even know for a fact. We don't even know that for a fact.
Julie, you bring up a good point. They just did a study in Florida that said 1 in 3 children tested. Here, I have this headline pulled up if we want to go to my computer. Give me just a second. 1 in 3 tested in Florida, the children came back positive with COVID. There seems to be this argument that, look, the kids don't get it, and when they do, it's not serious. Manuel, what do you think about that argument? And I just want to add to this that when we say the kids don't get it, that's not true for 175,000 children under 17 years old in the U.S. who have gotten COVID, and it's probably cold comfort to the families of the 228 children who have died from it already this year. Manuel, what do you think when it's, well, the kids really don't get it, so it's safe for them to return? In fact, can I set this up, Manuel? I'm going to give you, this is a bite from Amita Sudir. She's at the University of Virginia. And let's just hear what she has to say, and then we're going to come to you right afterward, Manuel.
All of the available data suggests that schools can reopen safely without significant risk to teachers or students. Mask wearing in schools, just like in hospitals, could significantly eliminate the risk that schools could be a source of community outbreaks. Schools need to reopen, not in spite of COVID, but because of it. COVID is a disaster like none other most of us have seen in our lifetimes, and schools play a critical role in disaster recovery, especially for the most vulnerable among us, who need not just the education that teachers provide, but the services provided by schools so that they and their families can weather this pandemic and overcome the disadvantages that they faced before it even began.
Manuel, what do you think?
Yeah, the key word in that was significantly, which means, yeah, maybe all those protections can decrease the number, but they can't get rid of the number. And significantly isn't enough. I don't think there's any number of students that anybody is out there ready to lose or to risk. For me, myself, I'm most concerned with the fact that my students live in extended households. I mean, they have a lot of them have grandparents in the home, uncles, aunts, and I don't want my kids to just even take the risk of going home and spreading it there. And also, even with all those protections, if you think masks, possible face shields, physical distancing, if I'm a teacher in the classroom, that means I'm not having group work, I'm not circulating materials. A kid needs a pencil, I guess I can't just give them a pencil. And when you take all those factors, when you put them all into place, then you got to ask yourself the question, is that condition of learning that much better than distance learning. Of course, as a teacher, I don't like the distance learning model. I signed up for this profession to be in my classroom with my students, loving and learning and going through the content. But when you put all those protections in place, it's not that anymore. So then I got to ask the question, is it worth the risk to put them all in the classroom, or even half the students in the classroom with all those protections? And that's some sort of model that doesn't even mimic really our true learning model. Is that much better than distance learning? I would venture to guess that it's not, especially if students are in class worried about what might be spreading. And then I also want to salute Kimberly Chavez Lopez Bird. She was one of 3 Arizona teachers who were assigned to one room for summer online learning, and they followed all the protections, just 3 adults in a room, no kids, masks, sanitizing, all that stuff. And Kimberly lost her life after 38 years of service in public education. If it's not safe for 3 adults in one room following all the guidelines, I don't know what it's going to look like when you add students to the mix. And of course, even if students aren't spreading it, if that's true, and we don't even know if that's true, you have all the other adults. You have your librarians, you have your administrators, you have the counselors. It's just not worth the risk. There's not one student that we should be willing to sacrifice in the name of getting back in the school building. And if that learning in the school building with all those protections isn't optimal, then really we're talking about school just being there for the babysitting, not for the learning. And if school is there for the babysitting, I would argue that we should have stronger social safety nets so that we don't need our schools to be babysitters.
Anya?
I really want to get in here and just speak a little bit to these concerns are extremely legitimate, and every educator has a right to be very concerned about their own health in this situation. When we talk about not one child's life, you mentioned 228 children who are victims of coronavirus, and that's too many. In this country, over 1,000 children every year are murdered by their families. And when we have children that are at home, socially isolated, sometimes neglected, their parents are going out to work in essential jobs, they're not under the eyes of teachers that are mandatory reporters, they're not getting access to meals, to healthcare, to potentially to housing, to jobs. There are very legitimate health concerns on the other side of the ledger that we really need to be considering. Also, students' mental health. I've talked to psychiatrists for teenagers who are saying they're going to see a mental health crisis in the fall as it sinks in for these teens. And we've already had a suicide crisis in this country building for several years among our youngest children, especially girls from 10 years old and up. So there are no good answers here. There's no easy answers. But when we say risks, the reason that the National Academy of Sciences and the American Academy of Pediatrics have come down repeatedly on the side of holding in-person school when and where it is safe is because there are legitimate, serious life and death health risks to keeping kids at home as well.
Let's talk about a population of students that often doesn't get brought up in this conversation, and that's those with additional challenges. I'm going to bring in Erin Coyle. She's a disability rights advocate. Check this out.
It's especially frustrating as a disability rights advocate because students with disabilities are being left behind. And it's not always because people aren't trying. It's just so complicated to teach them through distance learning. But also, if we were to send them back, you can't have most students with disabilities distancing from people. Many of them need a one-on-one support with hand-over-hand interaction. Many of them don't understand or cannot physically keep a mask on for extended periods of time. Many of them just need that intervention, and they need that up close and personal.
Julie, we've got about a minute and a half left here. What do you say about some of Anya's concerns, about some of Erin's concerns, special population of students that Erin's talking about there, and then Anya is saying that there's this other side of schools, kind of a social safety net. What do we do with that?
So I was recently on NPR, and I did speak a little bit about this because in the spring, that was the group that I was the most concerned with. There are students who never reported in for virtual learning at all. They didn't come. And there are many students who moved or relocated because their parents lost their jobs. So we need to be thinking about housing insecurity. We need to be thinking about our people on 504s and special education students. If there is in-person learning, I think those are the students that should be prioritized because those are the ones who I'm most concerned about, who I believe that a lot of them did not get the benefit of the last quarter. We divide school into quarters a lot. So quarter 4, they basically just missed that learning. And so before we move on and move ahead with educating everyone else, we need to figure out where folks are.
Yeah, thank you. And we're going to end on that note, Julia, moving on and moving ahead. This is a tough decision. I can tell you for my wife and I, as I brought up at the beginning of the show, we had to make the choice this week. We chose to give up kindergarten year for our son and keep our 4 kids at home this year because we just don't know the effects of this virus on kids in the long term. I don't think we're worried about that. I got to thank all of my guests today for really an incredible and informative conversation on what's a really tough issue. We'll see you next time.